This conference will now be recorded.
Good afternoon, everyone. Thanks for joining us. This is Melissa Morin. I'm one of the public information officers for the Whatcom County Health Department. Thanks for joining us for April 29th, 2021. We have Erica Lattenbach, Whatcom County Health Department's Director, Cindy Hollinsworth, our Communicable Disease and Epidemiology Manager, and Amy Hockenberry, who's our Health Information and Assessment Supervisor and also deeply involved in our vaccine planning effort. Here with some updates. One of the things that we wanted to share with you was some of the data that we're going to be making available this evening at our community forum starting at 5:30 p.m. And so we wanted to give you a chance to see that and ask any questions ahead of the presentation. Just a few reminders here as we get started. Please do go ahead and mute yourselves, and we will have opportunity after we hear from our speakers for media questions. So at that time, we'll invite folks to go ahead and type your name and your media affiliation into the chat, and we will call on folks in the order presented there. And then lastly, as always, we are recording these briefings, making them available after a couple of hours, so later this afternoon on the Whatcom County Government's YouTube channel. And you can also get to those from whatcomcounty.us/COVID and on our media page there. So with that, I am going to invite Erica to speak.
Good afternoon, all. Thanks for joining us. I'm going to share some broader level data about where we are in terms of vaccination, and then I will ask Amy Hockenberry to dig in on some of the subpopulation data that we have. So Scarlett, could you, thank you. I didn't even have to ask the question. So as you can see, as of Saturday, and we update this information weekly, so we will have new data soon. As of Saturday, 42% of Whatcom County residents had at least one COVID vaccination shot. And so we anticipate the actual numbers as of today are a bit higher. It's also important, just as a flag, to remember that many of the vaccinations that have been given by our generous tribal public health colleagues at the Lummi Nation and Nooksack Tribe are not reflected in this data because they use a different reporting system than the one used by Washington State. So we do assume that this is slightly lower than the actuality of individuals who had at least one shot. Next slide, please. Thank you, Scarlett. And on this slide, you can see that if we look at those who are 16 and older, so who are actually eligible today, we have surpassed that 50% mark and are at about, and again, this is as of the 24th. So we assume that we're just a bit over 52% at this point, and that's receiving at least one dose. And finally, and Scarlett, if you could advance to the last slide in my part of the presentation, thanks. The last slide showed how our community is doing at getting vaccines to people. This slide shows how well protected our community is against COVID. So about 1/3, just under 1/3 of our population is fully vaccinated. And this is really kind of the dial that shows how close we are to getting to that community immunity. So we are at about 30% as of Saturday. So we anticipate it's slightly higher than that, but we are making good progress. This is also tracking pretty closely with what we're seeing at the state level. So state averages. So that's good news for Whatcom County as well, as we're tracking pretty closely with the average. And with that, I'll turn it over to Amy to share some more details about who is getting vaccinated and where.
Perfect, thanks Erica. Good afternoon, everybody. Yeah, thanks Scarlett.
So as all of you know, are those that are 65 and older were some of the first to become eligible to get vaccinated. So really happy to report that 73% of our residents 65 and older have received at least one dose, and 65% of that population is fully vaccinated. But over 50% of our population, 26 to 64, have received at least one shot, as you see on this chart. And then, and for our 16 to 17-year-olds, who for the most part became eligible on April 15th, almost about 25%, about 1 in 4, have received at least one dose. And again, this is of April 26th, so a little bit more recent of this information. There is a lot of concerted effort going on in our community partners and providers to reach out to our 16 and 17-year-olds. So I'm looking forward to seeing what this data will look like after this weekend. These are just really baseline snapshots, and we'll be tracking them over time. You'll go to the next slide. Yeah, so want to cover our race and ethnicity data. So I'll walk us through this table. We know that a person's race and ethnicity and the historical and current events of racism have real and unjust impacts on our health and healthcare. So it's really important that we pay attention to and work to resolve these inequities, especially with vaccine access. So what the data is telling us here right now is that the people of color in Whatcom County in general are not getting vaccinated at the same rate as people who are white. So of the people who initiated vaccines, so that's the second column and those in blue, 67% of that population are non-Hispanic whites, 5% being Hispanic, 5% non-Hispanic Asian, and then with 1% or less for the remaining races. I do want to point out that 12% of our residents who have initiated vaccination have indicated other as their race. And as Erica had mentioned earlier, at this time, this does not include the tribal nation data. We are working to connect those two systems so that they're interoperable, but right now it does not include that information. And just to look at the Hispanics for a second, while 5% of the population are those who initiated vaccines so far, this does make up 20% of that population within Whatcom County. So there's a lot of reasons why we see these differences, and there is a lot of really, really great community work going on to address this gap in vaccine uptake. So we'll continue to review these data, and then we'll continue to use for informing our planning and our outreach and coordination among all of our providers and community partners. And then lastly, if you go to the next slide. Yep, so we're also tracking vaccination by gender. So there's well-documentation differences between males and females in terms of when and how often they get healthcare. Females are often more likely to get care. So we are seeing a higher percentage of females who are getting the COVID-19 shot than males. So again, we'll monitor this over time, and we'll continue to use this information in our outreach, messaging, coordination efforts. And so that is the synopsis for our subpopulation data this time. As Melissa mentioned earlier, we'll be sharing this tonight and then as well into the near future. So I'll hand it, I believe, back over to Melissa.
Yeah, and we'll go ahead and open things up for questions now. So again, we invite any members of the media here who have questions, whether that's about the data that we've presented here or any other COVID related topics. Feel free to type your name and affiliation into the chat, and we will call on folks as they roll in. I will just note too that I forgive me if someone did already say this, but we will be sharing this data on a weekly basis on our data page at whatcomcounty.us/COVID data. The details of that are still being worked out, but starting next Tuesday, we will have this subpopulation data available there and be able to update it every Tuesday. Our first question is from Jessamine McIntyre with Q13 Fox. Jessamine, I'm going to go ahead and read out your question here. Jessamine's asking, have you sensed hesitancy in your county to date? And if so, what can be done to combat it?
I can start with that question. I think at this point, it's hard to know what's happening. We do know that there has been a bit of a slowdown in demand for the vaccine in the last couple of weeks. As many of you know, for the first 4 months through the vaccine campaign, there was incredible demand and certainly not enough supply on a weekly basis to meet the needs of our community. And that has shifted. We anticipated that there would be a slowdown in that immediate need and urgency for vaccine, but we don't have enough information, and we're early into this sort of shift to know what the reasons are that people are not getting vaccinated at the same sort of frantic pace that we experienced in the first 4 months. Some of it is that there's more supply, and you know, not having that that urgency around the vaccine. I think there's a variety of reasons why people may be waiting, which could include that they're waiting until a time that's convenient for them. They don't feel like they have to get the vaccine today or tomorrow. But we will continue to track that to identify what's happening. But it's really shifted in the last couple of weeks, so it's hard to be able to say decisively why that is.
Thanks, Erica. Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead and ask your question.
Hi, Melissa, thanks very much. Erica, with the current rate of vaccination, how long do you think it will take for Whatcom County to achieve herd immunity, and how are you defining that now?
Well, Robert, it's really hard to say how long this will take because we have experienced a bit of a slowdown, and it really depends on our community's ability to continue to have supply meet demand. You know, if we had 10,000 people being vaccinated each week, that would look very different than more targeted campaign approaches where we may be only hitting, you know, 50 to 100 people a day via mobile clinics or other types of more labor intensive but less sort of mass yield. So it really is, it's sort of too soon to say how long this will take. We're hopeful that we'll be able to reach that kind of magic herd immunity number of 80% by the end of the summer, but it really depends on our community's continued interest in vaccination and our ability to reach vulnerable populations that may have barriers.
Great, thank you very much.
Next question is from David Rossbach with the Bellingham Herald. David, go ahead.
Hi, thank you all for taking the time to talk to us. I know when we look at how vaccination has been broken down by race and ethnicity, it sounds like the numbers that are off on the American Indian and Alaska Native, some of that could be explained by just a different reporting system that the area tribes use for vaccination. But is it concerning for the Hispanic population, because that is an area you look at that has been hit harder in case numbers, almost 2 to 1 what their population number is within our community?
I can take this. Yeah, you're correct. For sure, the underreporting definitely for American Indian Alaska Native is not represented in that data. As I think I mentioned earlier, we're working with the State Department of Health and the CDC and the Lummi tribe at this point to make those systems interoperable. So hopefully in the near future, we'll have more accurate data to look at. And then as far as our Hispanic community, yeah, there's different layers of challenges to reach that population. I will want to highlight, though, there is a lot of great effort and community collaborations to make sure we reach this population. So while we've had a slower uptake, I think I'm hopeful that we'll continue to see an increase in reaching that population. There's been things that we've done with the Community Vaccination Center. We know there's things that have been going on with Peace Health to make sure that this population be reached. And I know that there's plans in place for the future to continue to, as Erica mentioned, have sort of different access points, and not just for our Hispanic community, but for many different populations throughout Whatcom County. So definitely concerning and also being worked on.
And if I can just put in a plug for the forum this evening, we will be talking specifically about some of the community efforts to engage with, particularly with the Latinx population.
Thanks to you both. Our next question is from Kelton Burns with the Western Front. Kelton's asking, have you been in contact with Western about a potential vaccine requirement for students? Is that something you would advise?
Cindy, do you want to take that one?
Yeah, we have a lot of contact with Western about their vaccination efforts. They are a vaccine provider, and then they have a way for their students to get connected to vaccines in the community as well. We have not had specific discussions about any requirements that the university will be making for students to be vaccinated in any of their settings.
Thanks, Cindy. Next question is from Jessamine McIntyre with Q13 Fox. Jessamine, go ahead.
Thank you very much. Appreciate your time. I'm wondering where Whatcom stands when it comes to the roadmap of recovery and the phase requirements. How confident are you in your ability to stay in the phase in which you are? And what are you expecting next week when the governor announces?
Yeah, thanks for that. Because the sort of reporting period by which the state will evaluate forward or backward progression or staying put has already passed, unless something changes with the metrics or the reporting, we do anticipate staying in phase 3 upon evaluation on Monday for the next 3 weeks. However, both our hospitalizations and our case rates are moving in the wrong direction, and we are concerned about our ability to retain that phase 3 status upon the next evaluation, unless we start to see that trend changing.
Thanks, Erica. Next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hey, thanks, Melissa. So yeah, following up, we were looking at the numbers. We see the hospitalization especially rising lately. Are you attributing that to like Easter gatherings, or are you seeing clusters anywhere else, like workplaces, certain kinds of workplaces, like restaurants, childcare centers, gyms? And then a follow-up with that. What are your fears for Mother's Day and Memorial Day?
Amy, Cindy?
I could take a little bit of that. It was a multi-part question, so I'll start with what I remember. In terms of concerns, I do think, yes, we have concerns about the numbers going up and the kind of this lull in vaccinations too, or less interest in vaccinations. So I think it's a balance. In terms of the, what are we attributing the all the current cases to? They're across a variety of settings and ages. So we certainly are working with a large number of businesses who've had an employee at work during their infectious period. But it doesn't necessarily seem to be linked to spread at the workplace, but it is from social contact that individuals are having in gatherings. So I think it just fits with all the requirements to keep your circles small. I know we've got some, new guidance on masking requirements coming up, but it's still, I guess it still doesn't make it a free-for-all. We need to be cautious as we move forward. And remember to stay home if you're sick and get tested, and all the other things that go along with our COVID habits. And if there's more to that question that I can answer, give me the rest of it.
Yeah, I'm wondering, if you have any specific guidance for the upcoming holidays like Mother's Day and Memorial Day. Thanks.
Well, not to be a continued broken record, but our advice and guidance for Mother's Day is the same as it was for Easter, for Super Bowl, for Christmas and New Year's, Thanksgiving, etc. We are not out of the woods yet with vaccine. We are nowhere near that community immunity, and so we need to continue to, like Cindy said, engage in the behaviors that we know can help prevent the spread of the disease. Amy, I don't know if you want to talk a little bit about the potential impact of the variants in our community on the increases in the cases that we're seeing as well.
Yeah, sure. To touch on the variants, I'm going to echo Melissa, what she likes to say, but we like to remind people we're just a bit of a microcosm of what we're seeing at the state level. So from what we're hearing from Washington State Department of Health and their epidemiologists, it definitely modeling data is showing that the B117 is definitely the dominant strain in Washington, where we likely assume that is also current and present in Whatcom County as well, and increasing. It's more transmissible than the earlier variants, and contributing to the increase of these cases and hospitalizations at this point. So even more so, to double down on what Cindy and Erica were just saying around adhering to our masking and social distancing practices through all of these upcoming holidays. The variants are here, like I said, more transmissible, and we want to see those case rates come back down, and it's going to take our community effort to continue to adhere to those social distancing practices, and if people haven't gotten vaccinated, make sure they're making an appointment as soon as possible for those who are eligible.
Since you asked a lot of questions within a question, I will just add to that the vaccine is effective when it comes to both what we've experienced with cases in the past and also with the variants. It is effective even with these new variants. And what we can also share is among the hospitalizations, they are all yet to be vaccinated at this point, and younger than we've experienced in the past.
Thanks all. We do have time for a few more questions here. So our next, oh, whoops, sorry, I skipped ahead there. I think we still got another question there from David Rasbach with the Bellingham Herald. So David, go ahead.
Thank you. Was wondering about the recent increase in hospitalizations. Are you seeing a change in demographics among that, particularly considering the vaccination totals where people where the elderly in the community are more vaccinated at this point than the younger?
Do you want me to, Erica? Yeah, I'll just restate. Erica was just sharing. Yep, and we are seeing a slightly younger population, as we know that the younger population being hospitalized, as opposed to previous hospitalizations being more of our older population, and that being contributing to that older population has really done a really good job of getting vaccinated. So we are seeing slightly different demographics from these hospitalizations, and those that are being hospitalized are yet to be vaccinated as well. So.
Thanks, Amy. And it looks like our last question here is a question from Jessamine with Q13. Jessamine, go ahead.
Thank you again, appreciate it. I'm wondering, as supply starts to meet demand and we're seeing that gap close a little bit, are you worried about the potential for waste and opening up, any place actually that has the ability to deliver these vaccines? And if so, do you have a plan in place to prevent waste?
I think I can try that one. The individual vaccine providers, whether it's a pharmacy or a provider or at our community vaccination center, that is a big part of what we are doing, is monitoring how many people are signed up for appointments. And when we get down to the last batches, we're really being careful about opening that next vial while we're that last vial or two, making sure we have people in line to get those vaccines. I think we're going to start seeing a shift here as the supply really does open up. And then I think it's a ways down the road. I mean, the ideal is that the vaccine manufacturers can provide vaccine to us in a variety of sizes, especially when we think about some ongoing sustainability. It'll make more sense probably if a vial can just hold one dose and a patient can, it won't be as hard for a provider to think, oh, should I give this in my office today? Should I open it because I have another 9 doses to give out of this vial if I open it today? That they'll be much more fluid in their ability to just open the vial and give the vaccine without having any waste. So we'll see that coming. That's going to be a ways down the road, though, before the manufacturers are still are able to make that shift in their processing and packaging. So I think it's all part of that tipping point of we're having to rapidly shift our whole approach. You know, we thought we were going to be doing mass vaccination at a larger scale for a little longer than we're anticipating now. We may have reached kind of this peak of the larger mass vaccination, and now switching our strategies to getting people where they're at. And then as part of that, you're right, making sure that we have the right number of people that makes sense for us to open the vial and administer the vaccine. But we don't want to miss an opportunity. If somebody wants to get a vaccine, we want to give it to them. So then there's that additional challenge of them making sure we have people ready for the whole vial.
All right, that wraps us up for today. Thanks everyone for joining us. And again, a reminder that a recording of this will be available later this afternoon. Take care and enjoy your afternoon.